Okay, I'm Tanya Easley and I'll be performing Trach Care. The first thing I want to do is perform hand hygiene and gather my supplies. My supplies are normal saline, hydrogen peroxide, a trach cleaning care kit, clean gloves, mask with eyewear, and an adult trach neckband. So I want to go to my patient, explain the procedure, and identify my patient ×2. Now, hello, I'm Tanya Easley. I'm one of the nurses today, and I'll be performing Trach Care. Can you tell me your name and your birth date? Okay, Mr. Smith. Like I said, I'll be performing Trach Care this morning. And with this procedure, the one thing I need you to do is if you experience any kind of discomfort or you want me to stop for anything, I want you to raise your hand for me. Okay. And I have my ambu bag here for my breaths. Okay. Now I want to perform hand hygiene again. And I want to listen to my patient. He sounds clear, so we will not need to suction at this point. Go ahead and perform hand hygiene again. And I want to set up my equipment. I want to put on my mask and eyewear. I want to twist the knobs on my sterile water and hydrogen peroxide. I want to take my sterile gloves out and lay them to the side. And now I want to reach in here and get my drape. Okay, now I want to pour my supplies over my sterile field. Okay. Then I want to get my normal saline and pour it. I want to lip it first. Lip it. Okay. Now I want to put on my clean gloves. And I want to hyperoxygenate my client with 3 to 5 breaths. Okay. Now I want to remove the old dressing. No. First, I want to remove the inner cannula. Remove remove my inner cannula. I'm going to put it in the biggest compartment with the hydrogen peroxide. Now, I want to separate my supplies. No, now I want to remove the dressing and take off my dirty gloves. Now I want to put on my clean gloves, my sterile gloves. Now I want to separate my supplies. I have a slit dressing, and I have two 4x4s. With my wire brush, I want to clean my cannula. I want to take it up by the lock part. Get my brush wet. Okay. After that, I will put it in the normal saline to rinse it. Now I will tap it against the base. That's for the excess residue. And I will reapply my cannula. Okay. At this time, I will clean my outer cannula with the gauze. I will dip it in the normal saline that has not been used yet. Using one sweep at a time. Top, one sweep, and the bottom, one sweep. And to dry it, I would use an extra 4x4 if I had it. Now, I will proceed to clean around my stoma. I will gather up my Q-tips, lay them in the same normal saline that I use to clean the outside. I will take one, clean my stoma, clean around it. Take the other one, clean around it good. One more. Clean around it good. Okay. Now I will apply my clean trach collar. Be sure to get this in place before I remove my old one. This around. I will line it up and I will go from side to side. Making sure it's secure in place. Now I will remove my old one. Well, like this is okay. Had it kind of mixed up, but I got it now. I remove my old one and discard it. Now I will assess my patient. I'm going to reapply his trach collar. Well, before that, I will want to put on his clean and dry split dressing. Being sure that it was 1 finger breadth between the trach, 1 finger width between the trach band and his skin. And it is that, and now we'll reapply his trach collar. Now we'll assess my client. Be assured that his oxygen saturation is 92% and above, and it is. Now I will discard the rest of my material. Make hand hygiene. Make sure that my patient is in a comfortable position. He's semi-Fowler's. His oxygen saturation is where it's supposed to be. He sounds good. And now I'll just discard this. Leave him in the most comfortable position, and then I'll chart.